You are listening to the Mom to Mom podcast, hosted by Stephanie Sinclair, founder and owner of How to Mom. This podcast is meant to empower women and bring the community together through storytelling and education. During these episodes, you will hear stories of triumph, heartache, and hope. You will hear time-tested tips and tricks shared by mamas and women. You will hear a variety of birth stories that will resonate with all birthing families, advice from professionals who have dedicated their teachings to pregnancy, birth, and moms. Here, you will find encouragement, support, and community, because we are your community, and we are so happy to have you. Now, on to today's episode. Hello. Thank you so much for joining us today on the Mom to Mom podcast. We are so excited to have a professional guest interviewee today. And I am going to introduce a pelvic floor therapist to all of you. And then we are going to dive in and she is going to answer all of our questions. So Michelle is joining us today, and she is a pelvic floor physical therapist and the owner of Moms in Motion PT. She is married to Ryan and has two daughters, ages 2 and 4. She loves being outdoors and has been building a new kitchen garden this year, which she hopes to grow many fruits and vegetables. She is passionate about helping pregnant and postpartum moms stay healthy, comfortable, and doing all of the activities that they love. She and her team have worked with over 250 women in the last couple of years, and they look forward to helping many more through the pregnancy, birth, and postpartum experience. Michelle Wall, thank you so much for joining us today. Welcome to the Mom to Mom podcast.
Thank you so much for having me.
Absolutely. So I am so excited. This is a topic that comes up all of the time with our clients, obviously, as birth doulas. I want to first let our listeners know a little bit of your why and how your company is so unique, especially which we hear just from the title of your company, Moms in Motion. What does that mean? And what sets you apart? We talk about pelvic floor health a lot, and we will get into that. But let's hear a little bit from you and your individual why, and then also kind of your business model and how it's different.
Yeah. I kind of jumped into PT thinking I wanted to go into outpatient orthopedics. And so I did that for a number of years. I was working in downtown Minneapolis right before I had my first baby. And then the pandemic hit actually right as she was being born, and she had to be hospitalized for a little extra time. And so we got home and we were basically in lockdown, which was really scary at that time to like be entering motherhood and not know if I could have people coming into my home, family and friends and other resources. And so that was a kind of a unique time to enter in. And then I actually subsequently never went back to work because I lost my job, and then the clinic that I was working at actually shut down. So it's a little bit of a unique thing. I wasn't really planning to start my own business, but it worked out timing wise. And I always say it's the biggest blessing in disguise, even though it felt really like a big bummer to lose my job.
Yeah.
It was the best thing that could have happened. And so since it coincided with me having my first baby, I was realizing all the things that are really hard to do, like get out of the house and go to your own appointments. You know, you have all these appointments, you're having to take the baby to the pediatrician or lactation or these different appointments. So it's really hard to prioritize yourself and your own health, let alone getting the baby to those appointments with you. Because most of the time we don't have childcare options, especially in those first like 12 weeks. If you're a working mom, you haven't set up your daycare yet, and may or may not have friends or family that can help you. And then you've got the whole added stress of if I leave them, if you're breastfeeding, then you've got to pump and all of the cascade of things that make it really difficult. And even if you bring your baby with you, like I kind of thought before I had kids, you just throw them in the car seat and
Yeah,
they just
no big deal.
I didn't really think about like feeding schedules and nap schedules and blowouts and like all the things that happen when you are trying to get yourself to an appointment. And then that appointment, you know, you you have the baby there and they might be crying or, whatever. And so then you're extra stressed that they're having to be entertained, and you might have other toddlers with you too. And so this kind of whole thing kind of came together, and I started Moms in Motion PT. So we actually travel to our clients' homes here in the Twin Cities, and we do offer virtual services for people who are outside of our travel radius. But we come to your home, we spend an hour with you in your home, with you one on one, and we keep your kids in their own environment. They can be in their bouncer, they can be watching a show, they can be with us. We'll hold them if we don't need our hands,
Yeah.
whatever. But we just add that convenience piece, that makes it so difficult for moms to actually get the care that they need, because there's just so many barriers. And so we're trying to take away so many of those barriers so that they can actually get that care, and receive the pelvic floor PT that most moms need after, even during pregnancy and then after having a baby.
Yeah, absolutely. And like deserve, I always say that to moms, like you deserve this care. You are worthy of taking care of yourself. Well, I think that is so unique because after having my babies, I felt like that was anything that I needed to take care of myself just felt like an extra added stress. It was like, okay, yeah, I know I need this, but like logistically, how do you make that work? How do you add that to your plate? So I think that's such a unique part of your business. And just like for women to feel really comfortable, right, in their own space and maybe with their own furniture, in their own clothes, like all of that can play such a role. I also think the blooming of your business is so authentic. Like, yes, super challenging time. And I guess I didn't really put it all together that you were having your first baby around the pandemic. And so not only going through all of those challenges just as an individual with becoming a mom, but then although those challenging times can be really difficult for it to blossom into something so beautiful and so authentic. I'm sure that really comes across with your patients because you were literally living that life and going, this is a missing piece. This is something that is not available here in the Twin Cities. So tell me, I know obviously with your education, did you have interest in pelvic floor prior to having kids, or was it kind of like this light bulb went off once you had that pregnancy and had that birth? Because as somebody who I have a 10-year-old and two 7-year olds, and even being in the birth space, I hate to admit this, but I definitely did not prioritize our society. We were not talking about pelvic floor health for sure when I had my 10-year-old, maybe a little bit more around my 7-year olds. But I feel like it's really been the last handful of years where people are really starting to talk about pelvic floor health. So tell me, in terms of like education and professionally, was this something that really kind of sparked itself and this interest when you had your own babies, or were you really interested when like during the education piece of school?
Yeah, so in the middle of PT school, I actually had a really wonderful, pelvic floor unit. It was called Women's
Awesome.
Health at the time. Most most PT programs, at least when I was going through PT school, didn't have a really robust, unit on that. Like I hear people, like even my colleagues talk about, oh yeah, we had a 2 hour lecture on that or whatever. But
Right.
we actually had a full unit, and we had a business owner who came in as an adjunct professor, and she taught all of it to us. And I was really interested in it, but it wasn't like quite enough for me to be like, I'm doing that for
Right.
sure. But I was definitely interested, and I was like, oh, that's really cool. Like that's a neat part of PT. But I think at the time I was just kind of like, but it's not like quite for me because I'm an athlete and I like want to work with more of like not necessarily athletes, but just like that orthopedic like
Yeah.
injuries and whatnot. That's kind of what I was interested in, because I had part of the reason that led me to PT school was that I had had some injuries myself and went through PT. And so I was kind of like, that's what I'm going to do, is I'm going to help people with, injuries. And so my background actually in undergrad, I became an athletic trainer. So that was my major in
Okay.
undergrad. So I was kind of like on that route of like, I want to work with athletes and help them rehab and like get back to what they're doing. And I, at the time, didn't really see that women's health could be that. But it
Yeah.
was actually really cool because, after I had my own first baby, I was like, well, I'm going to get back into running because that's what I do. I'm a runner, I'm a triathlete. So, um, I had these kind of principles that I had learned back in school. And I felt like I was a step ahead and just in terms of I'm a physical therapist. So I know the principles of like progressive overload and like how to get back to an activity safely. But I still was kind of like, there's no roadmap for moms for like how to return safely to various activities, whether that is running or weightlifting or hit workouts or whatever it might be. And so then when I kind of transitioned and decided, okay, I'm going to actually go into pelvic health, it's been really cool to see how like those two things are intertwined and
Yeah.
women still can be athletes even as
Mhm.
mothers and like they can be athletes for lifelong. It might not look like competing in marathons or doing Ironmans. It could be,
Right.
but also it's just being able to be like agile and run with your kids at the park and play tag and, maybe join in whatever sports that they're doing and practice their soccer or whatever, and not have symptoms.
Yeah.
So it's been really cool when I feel like I'm still working with athletes just because I'm working with moms and not everyone
Absolutely.
identifies as an athlete that I'm working with, but that's my goal is that like we have to have athletic bodies to do all of
Yes.
the tasks of motherhood well.
Yeah, absolutely. And like what quality of life means to you, you should be able to get back to that. And that can look different for everyone. Um, so let's talk a little bit about what are some of the most common symptoms that you see women come to you with? And kind of a two-part question with going into people's homes, are you still able to treat and do all of the things that you would do if you were in a clinic? So like internal exams, external exams, exercises, like all of the things that you do, does that just look the same and it just happens to be in people's homes? But first, let's start with what are some of the most common symptoms that you see?
Great question. So the most common reasons that people are seeing us are leaking, so incontinence. And sometimes that is, I mean, most of the time that's urine. Sometimes people don't always understand what like fecal incontinence is. And so it's not just like you poop your pants, it's also like if you can't hold back your gas as well as you would like to. And so
Right.
that's usually a secondary thing that we find on people's intake forms that they're marking that box. And so if you're
Yeah.
having trouble, like you feel like you have to pass gas and you can't hold it in, that's
Right.
actually a form of fecal incontinence. So that's really common too, similar with leaking. And then pelvic organ prolapse or like symptoms of that. So pelvic heaviness, pelvic pressure, feeling like there's like a tampon in your vagina falling out, those kind of symptoms are really common as well.
Yeah.
Pain during intercourse is a huge one that we see. And then just kind of like my abs don't feel right, or I
Right.
feel weak, or maybe it's an ab separation. And that can kind of be hand in hand with a whole host of other symptoms, whether that's like low back pain
Mhm.
or just that like tummy pooch or a C-section shelf or, whatever. But kind of, I guess, core concerns are another big reason that people are seeing us.
Okay, you guys, we're going to take just a brief break so I can tell you all about an amazing company, Body Ready Method. Body Ready Method is an amazing company that offers pregnancy and postpartum programs. I urge you to take a look at this, especially if you are wanting to stay active during your pregnancy and prepare for labor and delivery. This is also a great program to help heal and recover your body post birth. You can go to howtomom.com/links and follow the Body Ready Method link from there. Okay, back to today's episode. And I think too, like we're getting better as a society, but I think there's always room for an opportunity to meet with a pelvic floor therapist because there are some symptoms that you might be experiencing, and I'm talking to you listeners, that you don't even know is actually related to your pelvic floor. Like we just unfortunately didn't really grow up with that education and with that knowledge. And so everything is so interconnected. And I think we're really starting to understand just all of the different layers of pregnancy, and that just because we don't experience these extreme traumas during pregnancy and birth doesn't mean that there's not a need for therapy, right? Like, I feel like when I first started in the birth world, it was like if there was an extreme tear or if there was prolapse or like these really huge symptoms, that those were the individuals that needed pelvic floor therapy. And that, like, leaking and your abs being weak, like that was just what happened after you had kids. Like that was just a part of
Totally.
it. And I just want to continue and continue to like break down those misconceptions, because I know that you and I know that, and sometimes I have to remind myself like what I know is not necessarily what the common public knows. And you and I talk about, pooping and peeing and birth and push, like all of those things on our day-to-day basis, but that's not everybody's everyday life. And so we have to always have these conversations of leaking, like that is a symptom, right? And that's not just something that we need to now just deal with because we've had kids.
Totally. And the field of public health has changed a lot in the last 5 to 10 years, but especially even in the last 5 years. What you would have gotten in terms of treatment is really different
Yeah.
from 10, even 15 years ago to like the last 5 years. And so that kind of leads into that part two of your question too. Because now we're doing a lot more full body. It's not just this like honing in on the pelvic floor itself. Like, yes, that's a component, but you said our body is a system and it works together. And so it's not just like this hyper focused, we have to treat the pelvic floor. I always tell my patients the pelvic floor is usually the victim, not the cause of the problems. And so we're often looking outside of the pelvis to see like what is not working well, whether that's the core or the glutes, or do we have like a misalignment or something that's causing that pelvic floor to act in the way that it is.
Mm.
And so we're constantly searching. And so we really use this like full body approach to see like what is really the driver and the root cause of those symptoms. Of course, if they're coming to us like newly postpartum, we know that birth played a huge role in like what they're experiencing, whether they had a tear or just like that physical trauma that just happened.
Yeah.
And so sometimes it's just we need to strengthen the whole unit. We need to reconnect with that core and that pelvic floor together. But sometimes it's like years down the road, and there's a lot of other compensations that have happened that we need
Yes.
to kind of break through and see really what's going on and why is your pelvic floor acting the way that it is. And so one other thing that I think is cool that we're starting to treat now, and I feel like in the whole field of pelvic health, but not everyone's doing it yet, but
Right.
we are, is birth preparation services. So we've really been on the reactive end of things, and physical therapy in general is more of a reactive profession, even though wellness is in
Yeah.
our scope of practice. Because it's an insurance driven world, we don't practice that way because insurance doesn't pay for preventative services in PT. But now that so many practices have stepped out of insurance and are practicing kind of autonomously with a cash-based model, we're able to practice the way that we want to and the way that women deserve. Like you said, they deserve this education, and they deserve to know like what's going to happen with their body and what birth really is. And so one of the things that we work on a lot with pelvic birth prep is how do we prepare your pelvis in a way that it can actually do the movements that are necessary for that baby to descend down. um, how do we teach them how to effectively push? That doesn't look the same for everybody, and everyone's pelvic floor is a little bit different. The role of that pelvic floor is to get out of the way, and
Right.
so some people don't know how to do that, don't know how to actually let go of that pelvic floor. So we were able to teach that and teach them like how to push effectively. ahead of time so that when they get into the birth room or wherever they're birthing, that's not the first time that they're like trying to figure out what to do with their body.
Right.
Um, so that's like a new component that kind of came into the pelvic health space in the last couple of years too, which I
Mhm.
think is really cool. But all of that to say, we can do everything that we normally would be doing in a clinic in the home. And so we have a few tools that we bring with us. We have our treatment table, and we bring that, and then we do bring like sheets and gowns and gloves and lube and everything that we need to do an internal exam and to have people feel really comfortable in their space so that they're not like walking around their house naked.
Right.
We
Right.
sure that we're still using those same practices as if we were in a clinic, and
Yes.
patients do feel really comfortable. Then we do bring a cupping set too, which we'll maybe talk about in a little bit for
Yes.
C-sections, but we have that. We throw our pelvic model in our backpack so
Love
we
it.
can like educate and show people what their anatomy actually looks like. If we're doing a birth prep session, we bring our birthing pelvis and talk
Yes.
about the different things that need to happen. And then we've got some other, we bring kinesio tape if we're going to need to tape, that kind of thing. So we really have all the tools we need. The only thing that we don't do is we don't do any e-stim or any biofeedback. And like I
Yes.
said, the field has really changed. That's not really what most pelvic PTs are doing. If I owned a physical space, I would not buy those equipment.
Anyway.
Wouldn't have those in my clinic because that's not like a part of what I believe is best practice. And
Yeah.
so we really can do it all just in their home.
That's amazing. And I think what you said about education is so important, not only for the understanding, right? Of like being able to know what your body is doing and why it's doing it, but to like then connect with your body. A lot of times we hear or we think that if we're experiencing leaking or any of these other symptoms, that means like we just have to be weak. That has to be the reason. And what I learned, and it was so eye opening when I went through pelvic floor therapy, is no longer having that ability to like release and let that pelvic floor go. So in my mind, I'm thinking I must be really weak when really it was the exact opposite, and learning about my individual body and the responses that it was giving and how there was this disconnect between my brain and my pelvic floor. It was just like it was so incredible to be able to actually learn not just about pelvic floor in general, which of course that's great, but like my pelvic floor,
Yeah.
the symptoms that I'm experiencing now after, carrying 3 babies and birthing 3 babies. And I think this really leads to a conversation of another really common misconception. And I think I can speak to this just being a mom who had a C-section. I feel like when we're talking about birth, a lot of women have this misconception that the ones that had a vaginal birth are really the only ones in need of pelvic floor health. And so, can you talk about for us C-section mamas, um, how you can help us, the symptoms that we could be experiencing post cesarean? And also, I think what's beautiful too that we can speak to is just because if you are 7 or 10 or 15 years out from having your babies, does that mean that we just have to chalk it up and say, shoot, we didn't get the care we needed then? So we're kind of past that point?
Yeah, yeah, that's a wonderful topic and something that we work with a lot of moms that have had C-sections. And it's becoming more widespread knowledge that you're not spared. There are different pelvic floor concerns for a vaginal delivery versus a cesarean, but you're not completely spared. You still went through a whole pregnancy and still had that same pressure and those same postural changes, and we have a center of gravity change, and then we actually have an extra layer of healing that needs to happen since they cut through 7 different layers of tissue, and those aren't like sometimes like online you'll see people who are like
Yeah,
going through each layer, and it doesn't look like that in the body. That's just such a great depiction just to just show that it's not
the
just one
layers.
small cut. There are layers, and they don't heal like layers of a or like pages of a book. it's sticky in there, and we have scar tissue for a reason. And I always say, like, scar tissue is not the enemy. Scar tissue is really good because otherwise we wouldn't be able to heal and we would be bleeding out,
Right. We
And
need
so
that.
scar tissue is really important, but we also still want that mobility to be in the different layers. And so our ultimate goal is to keep things moving between the different layers after a cesarean. And so that starts early on for people to move um, around the scar, but we want that first to heal. So our like the first phase is to keep ribs stacked over hips as much as possible. So we're not actually trying to like do any kind of stretching because we're not trying to break open that wound, that incision line. We are trying to get it to heal. We want that scar tissue to do its job and to heal those layers. But a lot of times people will be really sensitive to touch. And so sometimes we start with a series of desensitization. So we're using different materials like a cotton ball and a piece of what are those like scarves that
Yeah.
you like juggle with.
Yeah.
And we move into like fleece and cotton and like a washcloth. And then we get a little bit more abrasive because then people can't even tolerate, anything besides really loose sweatpants right away because it's just so sensitive. And we want you to be able to wear whatever clothes that you want to wear. But if we don't deal with that, sometimes that stays really sensitive and just kind of alters what that feels like on your body. So that's kind of the first step, is that sensation and just regaining that. Some people are super numb in that area. Some people, I would say most people, kind of have that like ugh feeling of
Yes.
like they don't want to look at it, they don't want to touch it. And so in those cases, I'm like even more encouraging people to do those things, and to we talk about like positive affirmations when we're going to look at it in the mirror, you're going to look at it on your own, you're going to touch it and be kind to yourself in those moments, because the more we drive those ick feelings, it's not going to go away. And so I always tell people, like, I could do all the scar work like myself doing it to you, but that's not going to get rid of that like icky mind body connection. So that's a really important piece too, and can just lead to that that tissue not releasing.
Yeah.
It's almost like a trauma response. And so even if we do the mobility, a lot of times it kind of gets back to its old sticky self. If we don't also work on that like more holistic perspective of like, your body is perceiving this as a trauma and we need to work through that.
Versus like avoiding it, right? Like,
Totally.
got it. I know it's there, but I don't really want to experience that. And I remember a lot of numbness and almost like a tingling sensation. And what was so strange is I would touch it, I would feel it, and I knew my fingers were on my skin, but how that felt was very different than like if I were to put my hand or my fingers on my arm. It was a very unique sensation.
Totally. And so with that, we have to figure out, do we need to refer out to some mental health therapy? Like, do we have a real trauma response going on, or do we just need like a better mind body connection? And so we're working with that as well.
Yeah.
But then those early weeks are the easiest time to start working on that scar tissue. We usually don't start anything really aggressive where we're like on the scar itself and moving things around until like 8 to 12 weeks. And then, we wouldn't do any cupping therapy or anything until at least 12 weeks, because we never want to risk anything underneath that's not fully healed. We can see the skin, but we can't always see what's going on below, and we wouldn't want to risk any kind of injury. And the tissues just aren't as strong in those early weeks of healing.
Hey guys, it's Stephanie Sinclair, founder and owner of How To Mom. I'm just interrupting today's episode to make sure you are well aware of all that How To Mom offers. We, of course, are a community and a support group for all moms at all stages of life, but we also offer a large variety of services that I wanted to make sure you are well aware of. We offer birth doula services, both in person or online support. We have birth support groups with different birth packages to choose from. We also provide placenta encapsulation services, lactation services from our lactation counselors. We also offer postpartum services, birth planning assistance, belly casting. We have a registered dietitian, nutritionist. We also offer a variety of photography services from birth, newborn, and family packages. We truly have it all here at How To Mom. So please don't hesitate to reach out today to have a free consult and help us find the best way to support you in your pregnancy, birth, and postpartum journey. Now back to today's episode.
And so we wait until then, and we really get deep, when we talk about like where that incision is. If you look, and I don't know if you put this on YouTube, people who are watching, but
Yes, we do.
They cut right above that pubic bone. And so if you can see, this is your bladder. And so as they cut, that bladder is that first organ that skin is running into, or just those layers, the fascia, the connective tissue. And so a lot of times that bladder actually like gets partially, like the outer lining of that bladder gets stuck to that scar. And even years down the road, that can lead to urgency, frequency, painful sex, especially like deep penetration pain, because of C-section scar tissue. And so I always tell people it's better to work on it earlier just because it's easier, but it's never too late. And so I've worked with people who are 6+ years down the road, maybe even 10. And so there's definitely hope. And people are always concerned about the like C-section shelf.
Yes.
And so again, that's like easier to address early on because some of that has to do with the fluid pooling and how things are healing, but it's not a lost cause. There's definitely work to be done. And especially if you can be consistent on your own with some of that massage, or even like getting a cupping set and doing some of that yourself. I've seen some really great results, even years down the road in terms of mobility.
Right. And so the cupping, are we doing that for the mobility and also to break up that scar tissue, or is that more so the mobility?
It's more mobility. So I always say we're not really breaking up scar tissue.
Right.
That's kind of a misnomer that's been passed around a little bit. It's more we're gaining mobility between the different layers of the tissue. And so the scar tissue is probably going to stay there. We can't like actually get rid of it, but we can make it more mobile and change how it kind of how it acts.
Yeah.
And so we usually start when we're, like I said, when we're starting to get actually on the scar, because we do some mobility work around the scar before it's actually okay to go on it. Then we'll start moving it around in all different directions. Then we start actually trying to pick up that scar. And so we're getting, those other layers under the skin when we pick it up, and we want to see, can we move it in all directions? Can we go along that scar? And so basically that cup, what it does is it like sucks up that skin into the area, and we use sliding cupping methods. And so we put lotion down first, and then we're actually sliding that cup along that tissue, and it just allows us to get deeper than we actually can with our fingers, because it can actually be a pretty tight area, especially if people don't have a lot of extra tissue around there. It can be hard to actually grip, and especially if they're really tight on the backside, it's hard to actually pick it up. And so that cupping allows us to actually just get a little bit deeper and really work on that kind of slide and glide between the different layers. And so depending on how hard you squeeze, you can determine how much tissue and how deep you're actually getting with that.
Okay, and that's so amazing. That's the first I've ever heard that it's not actually breaking up the scar tissue. That is a really misconception then, because we think of, yes, I know that it needs to be there, but sometimes if we don't activate or have mobility, then it just, in my mind, I was thinking it just continued to grow or get harder. But it's really more about being able to be mobile, but still do its job, right? Because obviously we form scar tissue. So that's the first. See, I love doing these interviews, even if they're just for myself. I learn so much every single time. Okay, so that's amazing. Do you want to tell our listeners about a freebie that you will have live once this episode airs, which I am extremely interested, like I said, as a C-section mama. Do you want to share with everybody what's coming?
Yes. So I am putting together a little C-section, kind of a C-section 101 freebie. And so for the listeners, it's going to have information about a C-section. Even though if you've had one, you don't always get all the education about what actually happened to your body. And
Right.
especially people who weren't planning a C-section, unplanned cesareans um, are really traumatic for people.
Yes.
No one thinks that it's going to be them that
Mhm.
happens to. Especially, our C-section rates are really high right now, over 30%. And so 1 in 3 women is probably going into birth thinking, I'm not going to have C-section, and then they end up one. I guess probably less than that if our overall rates, some of those are planned, but a lot of women are not planning for that. And
Yeah.
so that can be pretty unexpected, and it's a rush situation. There's, lots of emotions. And so even if they were told some things while they were there, they probably didn't get the full story. So that freebie is just going to have some explanation about what happened to the body,
Mhm.
a few recovery tips, and then it's going to have a little intro tutorial to how to do some scar massage on yourself.
Amazing. Yes, very much needed. And not only a lot of those times it's rushed, but then you're also going home to recover with a newborn. And so really being able to get the education that you really deserve. So let our listeners know kind of what your travel radius is here in the Twin Cities. And if they are outside of that location, what does the virtual care look like?
Yeah. So I live in Rosemount and I
Okay.
cover our whole east side. So I do St. Paul and then the whole South Metro.
Okay.
So everything kind of Bloomington and down is my territory. And right now I have one employee, and she covers everything that's Minneapolis and everything west of Minneapolis and everything north of Minneapolis. And so our radius ends up being pretty large. In the North Metro, we cover up to Brooklyn Park, Brooklyn Center, Maple Grove, and then we do actually some pretty far-reaching St. Michael, Rogers, kind of that area,
Yeah.
and then over to Plymouth, Eden Prairie, and then even some of those like lake suburbs out by Lake
Yep.
Minnetonka. So some of that, and then as far as the South Metro goes, I go down to Lakeville. I have had clients in Farmington,
Okay.
Rosemount, and then, the whole like kind of St. Paul. We
Yeah.
do not go over to Woodbury,
Okay.
but I kind of cover St. Paul and some of that area. So pretty wide radius. If you're wondering if we cover your radius, you can just give us a call.
Okay.
If not, we can legally treat you as a physical therapist in the state of Minnesota, regardless of where you are located. And so virtual services are more, of course, geared towards the patient doing more of the work since we
Yeah.
can't do any of that hands-on piece. So a lot of it is education and more of that like self-treatment. And so if we are working through C-section recovery, then it is going to be more of that education on self-massage, which is a lot of what we're doing in person anyways.
Right.
We usually do some of it to them.
Right.
And then that education piece as well. So more focused on that self mobilization, and then really focusing in on those exercises and how do we get that healing to occur. And so that's a huge part of what we're doing in person as well. So it really does work out well. If people are in massive amounts of pain, I usually suggest that they try to find someone closer to them, because I
Yeah.
really think it's a gold standard for when we're dealing with a lot of pain to
Yeah.
have someone in person guiding you. But if we're just kind of working on some of those other symptoms that I listed, whether that's leaking or pelvic organ prolapse or like a general C-section recovery, if we're not having, tons of other symptoms with it,
Yeah.
then virtual works really nice.
Yeah, and I can imagine a lot of what you do is education, because
Mhm.
that is such a missing piece in just our standard medical model. It's, nobody is taking the time to explain what is happening. And so this is why when we talk a lot with our clients about creating a team, pelvic floor therapists should be a part of that team. And that can be during your pregnancy.
Mm.
And even if I tell people all the time to kind of shop around, even during their pregnancy, if they feel like, okay, I don't have the need right now. When the need is there, you're going to already know what therapist you want to work with, what
Mhm.
their model looks like at their business. And so then there's just no hesitation to reach out and start the care as soon as it's needed. So will you let our listeners know how they can get in touch with you and your team? And do you guys offer any type of like free consultations to see if you guys would be the right fit for them?
Yeah, so our website is momsinmotionpt.com. And so if you go there, we have a couple different things you can click, but the easiest one is the appointment request form. And that does not lock you into having an appointment. It is
Okay.
just to say that you're interested. And so it has, it asks questions about where you're located so that we know when we're calling you back if we're going to be talking about an in person or a virtual session. And so that phone call ends up being basically our free consult. And so
Okay.
we do a consult call where we're asking more questions about their symptoms, what they're looking for help and support with. And then it allows them to ask any questions for us. And so it is a little bit of like a little mini interview
Yeah.
for them to kind of get to know our model of care and kind of how we operate to see
Yeah.
if that would be a good fit for them.
Amazing. And we will have all links below in our show notes. So you guys feel free to scroll down and reach out to Michelle. I always urge people to take the time, look into it, look at her website, schedule that call, because I really think once you invest even that 5 to 10 minutes, you will see the value and you will have the right therapist at your fingertips when the need is there. Michelle, I did not give you the heads up on this, and I apologize. I usually do. So please forgive me for putting you on the spot. Whether it be from a professional standpoint or just a personal standpoint, which I love that your story includes both. And I feel like that's a lot of my story as well. It was through my own personal experiences that changed me, not only personally, but professionally. And I feel like that is very true to your story as well. But I love to leave our listeners, if there is one piece of advice as a therapist or as a mom that you wish you would have known, or a piece of advice that somebody told you that has stayed with you through your journey, what would that be? And would you be willing to share with our listeners today? And it can be anything.
Yeah. So, like you said, women deserve to take care of themselves too. And I think that when you take care of yourself, it makes you a better mom for your kids. It makes you more available physically, mentally, emotionally, because those those things that are lingering in your body that maybe you're brushing under the rug, whether it's like peeing your pants, oh, it only happens if I sneeze, so like only when I'm sick or whatever, those things weigh on you, and it takes a part of you. It's mental load, it's physical, it's annoying, it's frustrating, and it doesn't have to be like that. And so knowing that, especially now that things are so widespread, there's more access to public floor PT in general, that it should be a standard part of recovery, and that you don't have to live like that. So my advice would be to take the time to, like you said, call someone, reach out, and just getting that care that you need and you deserve so that you can be a better parent
Yeah,
for your kids and more available for them.
absolutely. I love that. And it's not selfish to take care of yourself. You are actually benefiting your entire family. And so I love that. Thank you so much for being a resource to really provide the care that, like you said, should be standard, and helping in this change that I think all of us professionals relate of just really trying to move forward and really trying to make sure women know their value and that they deserve to be cared for, and that people like Michelle and myself have a lot of passion behind the work that we do. And let us help you. You deserve it. So, Michelle, thank you so much for your wisdom today. Thank you for sharing with all of our listeners. I am so thankful that they have a resource here in the Twin Cities like yourself and your team. And like I said, all of her links will be below in the show notes. But thanks again. We really appreciate you and the work that you do.
Thank you so much for having me. It's been so fun.
So fun. Have a great day, everybody. Thanks for listening. All right, you guys, that is it for today's episode. I hope you enjoyed. If so, please subscribe to our podcast, comment, share, give us feedback. We'd love to hear from you. Thank you so much for taking time out of your day to listen, and we will see you next time.